So that's been a part of our efforts this past month. We've had 2 meetings with Data Haven, sort of looking at their initial results. And so if you dig into those, I mean, of the people in Fairfield that are probably into health data, and the interesting thing about this is it's not really just solely health, but it's a community well-being index. So it talks about, how safe do you feel to walk in your neighborhood? How responsive do you think the police are? And there's even a question about how responsive do you think local health is, about caring about your needs. And so it's some interesting questions and has a broad application, for the town in general. But so that's one step. We probably won't get the final version. We'll be working this spring and over the summer on doing the community health assessment, and then from that we do a community health improvement plan. And for those of you who've been on the board for a long time, then usually those priorities of the community health improvement plan work their way into the town's health department's strategic plan and become one of our, usually we have one of our strategic objectives is to achieve the goals of the community health improvement plan. And so that's one of the big things we're working on. I had the opportunity to teach a psychological first aid class for the CERT team. They had a bunch of new members. There was about 20 to 30 new members there a couple Saturdays ago. Participated in what was called a UASI radio call down drill. We have these fancy radios that are the Urban Security Area Initiative, several $1,000 radios that have all sorts of channels that I can talk to anybody pretty much throughout the state. If I want to talk to Greenwich Fire Department, I can dial it in and talk to them. And we have we worked a long time ago to get a regional public health channel so that it enables every health department to talk to each other throughout the state. And so participated in a drill there. We participated in a New England MRC Medical Reserve Corps call with the regional coordinator. And as things, as our efforts related to COVID decrease, we're sort of starting to come back to things that we did before. And so we're relaunching our Know Your Numbers campaign, which is one of our educational community health initiatives, where we get people to understand their glucose and their cholesterol and their blood pressure and their weight, and just to understand that and give them education about, all right, let's get all these numbers moving in the right direction. I'm sure you're familiar with it and seen other places, and we've done it for years before. And we do it with the Health Improvement Alliance, which is the area alliance of health departments, and the same people that we're doing the community health assessment with. We do this initiatives, the Health Improvement Alliance, and we'll do it throughout the region so we can combine data. We're starting up our Healthy Lifestyles program, which used to be our diabetes prevention group, but we've morphed it into more of a Healthy Lifestyles program. And we're working on our Dr. Duranko, our community health director, is working on new video for Public Health Week, talking about, sort of what is local public health. And so we've shot a couple segments already and put those out there, or getting ready to put those out there for Public Health Week. And just talking about the different aspects, trying to get the community to understand sort of the different things public health does, from housing to nursing to, disease investigation and all those things. So we have each health department is taking sort of a segment of that. So we'll be sure to send you all the links when we launch it. Our community health director has been doing a lot of work with Fairfield Cares. Recently got a large Drug Free Communities grant, so they're helping a lot with that, playing a role in that. Our clinic activity has been pretty quiet. We've only done about, I think it said 23, sent me an email, 23 vaccinations in the last month since the last board meeting. Just not a lot of demand there. We have a clinic scheduled this week, but we'll see how that goes. We've issued on the environmental side, this past month, we've issued 3 different orders, one related to a septic system, one related to housing, and one related to garbage. A facility that's not maintaining the garbage area, and we're having all sorts of issues with with turkey vultures getting into garbage and spreading things around and creating a general nuisance. And so we've actually sent letters to all the residents in that entire neighborhood to help them, please, let's try to see if we can get these birds to move on to another area. We can't really do anything to the birds. We just have to take away their food source. And so it's been a challenge. But the things that public health does.
What neighborhood is that?
This is up by Black Rock Turnpike, north of where Cinzano's used to be, behind that area, that neighborhood. It happens to be Brenda's neighborhood too. She wasn't the one making the complaint, but but we're working on it, and we've had issues. We've had issues like this in various neighborhoods from time to time, and so but blanketing the entire neighborhood with letters, helping them to be a part of it and trying to get past it. So, but that's the orders that we've issued. We did resolve last month. I think I shared we issued several no heat orders, which were all resolved successfully. And that really is the sum of my report. I think I covered everything. Oh, I did want to share the CDC. I forgot to mention the CDC announced their two things that I thought were important. They're launching a new test to treat program. So it's the distribution of antivirals to a variety of sources. And what the intriguing part of this to me is that the federal government essentially copied what Connecticut did with. So the federal government provided Connecticut with monoclonal antibodies and antivirals, and Connecticut said, well, we're going to put them right at the pharmacies. We're going to put them right at healthcare facilities that have their own internal pharmacy, like long-term care facilities, and that deal with high-risk people, and federally qualified health centers that have their own pharmacy in there. And so essentially when someone takes a test and they test positive, they can get a script right there and get their prescription filled and get it right away. And start the treatment, because with at least with the antivirals, you got to get them early, within the first few days of testing positive, so to be most effective. And so the federal government has kind of rolled out that program as well, and so they're going to be pushing out millions of courses of antivirals over the next, it's 3.5 million, courses of antivirals by the end of April, and so that'll be another step in reducing severe outcomes for those who are at high risk. And then the last thing is they updated today that Moderna submitted for 2 to 4 year olds for approval with their vaccine, and Pfizer expects to submit soon, and so they're currently saying sometime by late April, early May, there should be a vaccine available for that age group. So we'll plan some clinics at that time, but we don't think the demand for our clinic services will be that high with that group. They'll mostly go to their pediatricians. So that's my report.
Great, thank you, Sam.
Sure.
Jill?
Okay. Just a couple of things. Of course, our COVID cases have gone down. It's been now just 2 weeks since we've gone mask optional, and I think that the numbers were certainly higher at February 28th, and the number of people wearing masks has certainly decreased over the subsequent 2 weeks. The numbers of positive cases have also decreased. It's difficult when you should keep in mind when you look at the Monday cases, they usually are the cases that come in from the weekend as well. I mean, if you were, I've had 4 cases, I think, yesterday reported to me, but the school nurses get an awful lot, as do the absentee lines on Monday morning. So that number looks a little high sometimes, but I don't think it's really representative of the rest of the week. We have had, since we last met, we've had 3 clusters of cases. One was prior to the mask optional date, just in late February at one of the elementary schools. There was another cluster at Tomlinson, and today there was just another cluster at Dwight. And we've looked into it. Clearly, the Dwight situation hasn't been resolved, but the other case is resolved, and we really heard about the cases fairly quickly over the space of about 3 to 4 days. The nurses, keep up with the surveillance. We usually notify the members of that class, not at Tomlinson, I should say, but at the elementary schools we did. And we notify the parents and send home test kits with the children, and we had no additional cases. Narcan training, that's continuing. After Jason told me last month that we should do more, so we did more. We had training last week at the early dismissal day, and it was over at Ludlow High School. There were staff from Ludlow, one staff member from Tomlinson, and a handful of people from Roger Ludlow Middle School. So it was great. We had the fellow come in from the fire training. He's associated with the fire training center. And I actually stayed for the training. It was quite good. Really an engaging instructor. And he'll be doing it again at Woods on Wednesday. So having done that, we've provided extra Narcan in all of the AEDs in the buildings. We have 2 at the high schools. Because they have 2 AEDs, I should say that. And 1 at the middle schools. And I had a meeting with the private school nurses today, and they're going to go back and see if they're interested. And I'll talk to Mr. Cummings about elementary school placement as well. And finally, recruitment. Recruitment is going rather well, to tell you the truth. We've hired 3 sub-nurses the past couple of weeks, 1 full-time nurse to replace the nurse who retired at Notre Dame. And I'm fairly certain I'm going to go ahead with 2 more full-time nurses. So that'll bring us almost up to full staffing, but we'll see. Yeah, that's it.
That's great.
Just a couple questions. Do you think that staffing change just had to do with kind of the changing landscape of COVID and maybe some people coming out who felt more comfortable, or was it just like it just worked out, the timing worked out, or who knows?
From the nurses that I spoke with, the nurses that I interviewed you, I would say, I can't say that really.
Okay.
2 of them, the kids are heading off to school and, they're more available and they want to use their license. 2 others retired from, or I can't say retired, but resigned from hospital placement and extended care facilities, and 1 is just returning to work. So it's kind of a mixed bag.
That's good. I'm glad it got filled. And then the other thing was you had talked about the clusters. So my question would be, you said there was the one right before Mass Choice and then the one after. So the one prior to, did you know what that setting was in particular, where the cluster occurred? Like, if it was in the context of, like a lunchroom or no?
It was, well, it
involved
5 students in one community at one of the middle schools, one 6th grade community at the middle school. Let me see. 2 of them did know each other outside of school. And then one of those 2, I can't say that, hold on. Both students either had science class together, 2 of them had lunch together, and 3 of them had homeroom together. But it was kind of, a web. It wasn't this 3 and then another 2.
So hard to pin down exactly then.
Well, I mean, they were all connected.
Hanging out together, yeah.
Patient 0 certainly had connections with all 4 students, all the other 4 students, either socially, science, lunch, or homeroom.
Okay. No, I was just curious because for a long time there wasn't the in-school transmission, and then if that just had to do with the more contagious nature of Omicron and other mitigation strategies not working as effectively as they did before. I was just curious.
Yeah, I mean, we've had clusters before this, and it's usually, these ones where we call it a cluster because we suspect that it's some in-school, potentially some in-school transmission, but there's some indications of outside of school. But a lot of the clusters had the same dynamic. It's like 2 or 3 kids knew each other, or they were on the same sports team, and then they brought it, they came to school, and so that's continuing, that's to be expected, but I think it's part of it is Omicron and that it's just a little bit, more contagious than other variants. And so we're keeping track of it, and we'll kind of report on the sort of next month once we get a more indication of, a little bit more time, I think.
Yeah.
And have the chickenpox, the varicella, has that subsided from that?
Just those 3 cases.
Okay.
That was it.
Didn't know if there was anything else that had popped up after. No, fortunately, right?
Yes.
Okay.
Have you seen kids needing tests and then just being negative, or like with the mask coming off? Mask coming off. Any more visits to the nurse just with the common cold, or?
Oh, yeah.
Mm-hmm. Yeah.
Certainly, upper respiratory illness is prevalent.
Yeah.
Seasonal allergy.
That's with allergies.
Well, yeah.
Do you think we're really in seasonal allergy?
Oh, yeah.
Yeah.
Even when it gets like down to 20 degrees, you can see like crocuses around, and then,
You're right.
Yeah. March 15th was the day that, my pediatrician for my daughter who's pretty allergic said, March 15th, go on the allergy medicine.
Yeah.
Great.
And we've even
So
seen
I would say it's probably more so than just the regular viruses that we've forgotten about from 2 years ago.
And we've seen a slight increase in seasonal influenza as well, so.
Oh my gosh, that's true, yeah, I was testing, we have that multi-test where we check it's definitely a test for flu A, flu B, RSV, and COVID. And the flu A's have been coming up. Last week it was about 5, and no COVID, but it's weird. It's made a switch. I know, it came out of nowhere.
Oh, that's interesting.
I think I know for me, just even the dusty kind of heat that comes out from mine too, that's like drying, or that has allergy producing too, but, okay.
Interesting,
Is there any old business that is unfinished that anybody wants to talk about?
Well, and we have no communications either.
No communication?
Wow.
No business.
Good, the order, yes, no communications.
No.
Okay, so then, no old business, any new business anybody wants to bring up?
So I just put it on the agenda, and I talked about this document, which I shared with you, the link to, is the Data Haven survey. And this is, for those that are into data, this is, an interesting report, worth kind of going through to sort of see what the questions ask, because they ask a lot of unique things. But also I came across this, and this is also a Data Haven product, which I linked to, that will work in. So there's this racial justice and equity task force going on in the town of Fairfield. And so, I've met with the folks, the members of the task force, and was interviewed by them, and they put out their blueprint recently, and so the town is working through some of the improvements that are suggested. But this provides some really, for those who are into data, some really interesting different perspectives. I mean, it captures a wide variety of time frames. So when you look at the data, you want to look at all right, so this is 2015 data, but it's still presenting the best data that they have available. But there's some interesting things here. One of the things that that we've worked on, we've had cultural and linguistic appropriate services training a few times now in the health department, and have worked to really try to address that issue of someone who presents to our department with a language barrier, that we have robust means to communicate with them. And so we have a cybercomm language line that we can call, and they provide medical interpretation as well as general interpretation services. So we have that. But if you look through this report, I mean, I'm just saying, like on page 5, they talk about people feeling in linguistic isolation, and so this has one of the interesting things about both these reports is this one is Fairfield specific, but it's also tied to the entire state and the county. This one is Fairfield specific, so this is gives data on unique variables that are just the Fairfield. So, for example, it's talks about 14% of Latino people identify as Latino, report linguistic isolation, and 26% of individuals who describe themselves as Asian report linguistic isolation. So these, those are things that we say, okay, well, let's make sure, at least when we're providing services, that we're addressing those issues and are attempting to in our services and our educational materials and things like that. And but the report is filled with lots of things, examples like that is interesting reading. So I just thought I would share that. This stuff will be moving its way through our work. I've asked Kim, who I mentioned earlier, to apply for the MRC grant to also, take the lead on, the quality improvement project for our linguistic, our cultural and language appropriate services sort of improvement project to try and sort of improve things for us. So.
I have a semi-unrelated question. This has to do with how is Fairfield doing as far as the daycares and the preschools and the math choice piece, because I know that has been a concern for a lot of parents. Many of them have made the choice to allow for math choice, but there's been a real variety. And I'm just wondering how much we're advocating for that, given the fact that that is, clearly there's a lot of different opinions, information. I know we brought up at many other meetings, but like World Health Organization not even recommending masking under age 5. Certainly we now have the school age population, even though it's certainly not a high vaccination rate, having the mask choice. I'm just wondering if you've had much discussion with that population and what you're seeing, because I know that there is still a lot of frustration between the communication of some preschool daycare providers or families who have their kids in certain locations and Best Buy at the state level. And clearly that's an issue that's coming. I know we're in Connecticut, but New York, that's been on the forefront there, where all of a sudden the announcement was made that they are going to allow for a choice in that preschool population. Again, this is coming from me as that advocate from the perspective of speech language development, of all the social cues, that are necessary. Anyway.
Yeah. So, to get you the latest, I probably have to talk to our contact tracing team, because they have the most interaction with child care providing services at this point. If you have any insight, I know we've, conveyed what the state message is and.
Yeah, I don't know how universal it is. Do you have a specific pre-K programs that are not offering?
I know that it was on a case-by-case basis, because based on one of the Instagram pages, the Fairfield Math Choice page, that they were kind of targeting or asking which preschool is having people write in and daycares which had been allowing it, and just little by little they had been making allowances, but it's completely dependent on the organization itself, right, or on the private. So it would seem to me, it would be, in my opinion, that it would be important for there to be a little bit of liaison work happening between the health department and those facilities, as far as maybe developing a comfort level. And again, going back to the point of, you have like the absolute lowest risk population still masking, which is not the recommendation of certainly every health organization, of some, and again, but that's just where we're at. And that Connecticut is one of the very few places that even had that instated to begin with out of the entire U.S., Europe, et cetera. So I just want to make sure that that's something that's being addressed kind of in a proactive manner. So then the other thing is, I know we talked about, that was awesome, everything you said about the other health programs, diabetes, what did you call it? Know Your Number.
Yeah.
That sounds great. And then going back to, again, the mental health piece, because looking at more numbers that have emerged from 2021 and the major increases in suicides in, the elementary and upper level age population, and also mental health, like psychiatric hospitalizations. I'm just wondering how that's going, I guess, from the Fairfield Health Department perspective. And also, I know that doesn't totally fall under the nursing, because there's all the, school psychologists, but how that, is being addressed, just to make sure that we continue to target that. And there are some good school board of ed programs that have been implemented or heightened, so.
Yeah, I mean, our efforts go towards ensuring people are aware of resources.
Mm-hmm.
So if you look at we have a mental health tab on our page, and that we try to keep that updated with the latest resources about it. Basically, if anybody's experiencing any kind of mental health or substance abuse issue, that there's, every crisis line is there, every text feature is there, every, federal, state, local, every resource is there that we can provide. We don't provide direct mental health services as the health department, but we look to ensure that anybody looking to the town, if they come to the town, to the health department page, that they're going to find all the resources they need, both, local, state, and federal. So that's, if you take a look at our page, we're always open for suggestions. If you have other resources, we try to keep it up to date. And, I know.
Well, and maybe since you're doing some of the videos, maybe one on an upcoming video could just be that reminder that there has been this major emphasis on the COVID piece, which is where it was, but as we're seeing now the cumulative effects that have emerged based on the 2 years that we've been going through this, and just what that means for health now, that would just be my thought, but that's really it. I don't think there's anything else that I feel like needs to be discussed. We had our little email thing, but I don't feel like I need to go into anything on that now.
What you were talking about in terms of language and interpreters is like the information that's distributed to that's available to the community. Is it only in English, or is anything in Spanish that
So, as certainly for the schools, we have, especially like McKinley School, where there's a lot of different languages there. We have used Cyrocom to translate.
Awesome.
Often different materials that we have.
It's a great service. It's really wonderful.
And so the health department actually worked to have the entire town website have the Google Translate on it. So at least it doesn't work for everything. It doesn't work perfectly. We have things that are text in there, like that are actually typed in, not like a PDF picture of something, will get translated.
Oh, that's great.
So we have that. Before COVID, we kind of took it down during COVID, but we used to have a tablet out front with one of the Google Translate services, so you could just touch, I'm speaking Chinese, and it comes out in English, and then I can say, all right, I'm speaking English, and it comes out in Chinese. So that type of thing, we had that, but we tend to default to the Cybercom, which is
that like the translation line? For my work, those are great.
Yeah, it's just a fantastic service, and it's...
Any dialect, anything.
Yeah, believe me, I've just gone into houses
we used it at the COVID...
and I'm like, we can do this.
Like, right at the COVID clinics, we used that. We used it in a variety of, Jill and the nurses use it the most, but we've used it here just for, someone called about, an issue with their housing or something like that, and we were able to, it turned out they lived in another town, but, but we were able to figure that out and try to connect them with those resources, so.
And when we do our usual childhood vaccines down at the clinic, they all come in, you just go to the CDC and they have all those translations for consent forms and the information statements.
Yeah.
Great. Are there any other comments anybody wants to make?
What I did want to mention, though, you talk about the mental health issues. I don't know if you're aware of it as well, that there's a new requirement for healthcare practitioners in the state of Connecticut to renew your license. You have to have PTSD and suicide training. That went into effect at the end of January 1st, I think, 2022. So I
Is that for nurse, MD?
Nurse, MD.
I wonder if it is. I'll have to check.
I think it is.
I remember seeing it.
I did not. Did you know that?
I did not.
Did not know that.
Is that the QPR training?
What training?
QPR.
Usually they have that
Employee
one,
prefer-
about 4 or 6 years, you have to do that Medicare training, which is like for the AIDS and the.
Yeah, there's a lot of other things like
veterans and
behavioral health. There is certain training on
but not
behavioral health.
specifically that.
it's a HIPAA thing they have to go through and
It
all
was
that.
the only requirement
But,
nurses
that's
ever had
interesting.
to do that, I'm aware.
So
PTSD and,
I
So
think,
thank you for mentioning all this stuff.
Yourself.
you know what, I
Yeah.
think it's
Yeah.
totally reasonable.
Yeah.
I mean,
Yeah.
it should.
Yeah.
I think, everybody's been affected. I think it's not a bad idea if we have a little bit more
Right.
knowledge.
But I just renewed my license and no one asked me for it, so
Oh,
I'm sure it takes a while.
we strongly recommend.
Every 6 years.
Yeah,
You'll
okay,
have
so
to
it
do
must
it.
go bunched up with the other 6
Mhm.
years.
Right.
They usually
Oh,
give us.
is that right?
We
Okay.
have, the 4 or 5 topics they have.
Yeah,
Years
it's like-
ago.
DCF training and all that? We have to do that every 2 years, but that's,
Yeah,
on us.
Some are
Right.
other infectious disease, like, and a lot
We
of
should
it
have
has to
more.
do with, sort of policies, it's like HIPAA, for example, and other, patient interactions and, sexual harassment.
Sexual harassment, there's a
that's-
veterans thing, and there's the HIV.
Yeah, we have sexual, that one was so long, remember how long that was? And you couldn't like scroll, you're like, oh.
Oh, no.
but that was actually, isn't that
Yeah, we
a
did
federal
first
requirement
The
now?
Norwalk Conference Center, is that where you?
Yeah, I know,
We had-
I know, we had.
Yeah, we had to do
Yeah. Yeah,
But, yeah.
but I think, listen, all those things, I think that,
Yes,
I mean, this particular one makes
that does
very
make
much
sense, yeah.
sense. I agree. That's good.
So you might have a new Board of Ed representative for Board of Health at the next meeting. This might be my last meeting.
Oh,
Thank you.
really?
Thank you for serving.
Oh.
Yes, thank you very
It
much.
might be, I don't want to announce who it'll be, just in case it changes again, but,
Okay.
it most probably will not be me, but, I wanted just to, thank you for.
Well, thank you for being with us.
No,
Yeah, no, we appreciate it.
Hopefully I'm leaving now and just calm waters.
Great timing.
Yeah.
All thanks to you.
Thank you for what you're doing on the Board of Ed.
Now I can get somebody thing to say, like, oh, anybody want to Board of Health? No, that's okay. But,
Oh, gosh.
but it was, it's been really a pleasure to serve with you through these difficult years, and, a learning experience learned from each of you. And, thank you for your continued service if I'm not here.
Well,
in,
thank you
next
for all
year.
you've done, yeah.
Yeah, appreciate it.
Absolutely.
So,
So if there's nothing else,
I'm sorry that I shared that with
That's fine.
yeah, a motion to adjourn.
Okay. Anyone?
Anybody want to make a motion to adjourn the
Motion
meeting?
to adjourn.
Second.
All in favor?
Hi.
All right. Thanks, Mary Fran.
Thank you.
Thank you.
How's it going?